Welcome to the Psych Eval podcast. This podcast is about
evidence-based research to support mental health,
psychiatric practice,
and frontline workers.
You can expect to hear viewpoints from nursing
and law enforcement.
We're your hosts, Jessica
and James.
Today we're going to be talking about the ACE study, which stands for Adverse Childhood Events. I wanted to have you on the podcast to discuss this because I think that although you might not have a lot of knowledge about Adverse Childhood Events study, you see the kind of health outcomes in the prison because it does have a socio-economic impact and different health outcomes for people. So how the ACE study started is it actually started in an obesity clinic. And they had this woman come in, she was like 400 pounds, and what they were doing is almost fasting people to help them lose weight. She was able to lose the weight. During this time, she was doing really well. Then all of a sudden, she gained all of the weight back plus some. So they looked into what happened, like why were you doing so well and then all of a sudden you gained the weight back? What ended up happening is a much older man made a sexual advance at her, and she realized that she didn't like being skinny. She wanted to be bigger because she didn't have to have those types of encounters, which I know is terrible, but that's the way it went. So they dug a little more into that, and they actually ended up finding out that she had an experience of childhood sexual abuse from a family member. She was very much triggered by this older man making a pass at her. She had said she would rather be obese than have people making sexual advances because it was very triggering. So that kind of got researchers to look into how do our childhood experiences impact things like obesity, different health things like heart disease, COPD, substance abuse, mental illness, and that kind of opened up the floodgates for the ACE study. So the ACE study, it's a very big study. They studied, I believe it was like 70,000 people in this study, and they looked at people over a 50-year span. So they followed these people for many years. And the way this works is that they have a questionnaire, essentially, that is asking about different adverse childhood events. So these include 3 categories of abuse, so physical abuse, emotional abuse, and sexual abuse, growing up in a household with an alcoholic or substance user, a member of your family being imprisoned, in your family having a mental illness or being depressed or institutionalized, a mother being treated violently, loss of a biological parent, and then also 2 categories of neglect, so emotional or physical neglect. Each one of these categories, if you've experienced this, it's not the number of times you've experienced it, it's if you have or you haven't. So if you have experienced it even one time, you would get a point. So the highest points that you can get is 10 points on the ACE study. So just to put in perspective, I know this is a lot of information, but 66% of the population, so 2 out of every 3 people, will have an ACE score greater than 1. 25% of people have an ACE score of 1, 15% have an ACE score of 2, 10% have an ACE score of 3, 6% have an ACE score of 4. But where we get into the real important stuff is that 17% of people have an ACE score higher than 4, so that's 1 in 5.8 people. And 11% or 1 in 9 have an ACE score greater of 5. And what the researchers ended up finding out is that the higher your ACE score, the more likely you are to have these negative health outcomes, which we have a lot more information coming up on that. So just to add a little bit more info is that the CDC has found that 1 in 8 witnessed their mother being hit. 1 in 5 women are raped in their lifetime. 1 in 5 are molested who are under 18. 1 in 4 are physically abused, and 1 in 4 have alcoholism. So any input on any of that? It's a lot of information.
Just throw this out there that I'm familiar with ACE because our mental health uses it for the mental health intakes. It's something that is part of our questionnaire. It's something that not only is part of the questionnaire, but they build on it for mental health assessments.
That's great. I think at the core of adverse childhood experiences, and another way to say that is trauma. When you go through trauma specifically as a child, your brain is making so many neural pathways when you're a child because your brain is growing and building. When you experience trauma, it does interrupt those kind of neural pathways. It does make them different. That's why a lot of times we see children who have had trauma later can manifest as, and you probably see this in adults too, but manifest as hypervigilance, being very on edge and jumping. Sometimes people think these children have ADHD because they're all over the place a little bit, but that sometimes can be a trauma response. Trauma, like you were saying, adverse childhood events, they are at the base of a lot of mental illnesses.
Not even going into mental illness, but there is stats on it. For example, if we were talking about sexual trauma and sexual crimes, if someone had done a sexual crime and they are convicted of it, more often than not, they'll tell you that they had the same crime happen to them, even if it wasn't even related to a sexual crime. That doesn't increase on drug use. That has an increase on those kinds of crimes based off your experiences of you had a loved one that did that. So that relates to the book, The Body Keeps Score. Like your past builds up into who you are, affects your present, and then it can potentially affect your future. And that's what criminology is about. It's about your surrounding aspects of your life, of how you interact with life, and the likelihood that you will or will not do a crime based off your experiences and what you have been through. Even some of those aspects, like based off education, based off who your parents are, some of that even defines it even before you were born.
Oh, definitely. There's a huge correlation between your environment and your outcome.
Yeah.
Even just the town you live in, where you go to school, what resources you have. Unfortunately, for example, 1 to 3% of people or children in foster care get a college degree. That's it. 1 to 3%.
Yep.
That is crazy. That is crazy. I read that and I'm like, wow, that's not a lot. That's 1 to 3 out of every 100.
And I was just thinking about it, but with the ACE study, this relates to in probation and parole. When you go on probation and parole, they have something called ORAS, the Ohio Risk Assessment System. And ORAS is used as a risk system to classify you for your risk level for probation and parole, whether you are low risk, medium risk, high risk, or based off if you're on parole or probation, they'll use intensive supervision.
So what characterize like low, medium, and high? Are there certain...
There's a score system of 1 to 24 points. Similar to ACE, like how did you grow up? Has your family done crimes? Do you have an education?
Okay.
What's your level of education? What kind of crime do you have? Which, not to profile anyone or anything like that, but based off your crime, will have your risk of being reinstitutionalized.
I would imagine too, and I don't know, this is just me assuming, so maybe you can clarify, but I would imagine if you had a history of substance abuse, that would knock you up higher because unfortunately it is an illness and it probably does need to be supervised higher than like someone who maybe had like petty theft or something.
It's 12 questions per section and 7 sections. And then you get a score of 24 points. And then they actually score the system different for men compared to women.
Oh,
like for women, you have to have a higher score.
Oh, okay.
In regards to that than men. Probation and parole, they use 2 different studies. They have something called RAISER, which is a risk assessment for sexual crimes. And then they also have another one called Static 99.
You had mentioned earlier, I was just thinking this in my head about people that have been through a certain crime may repeat it. My add-on to that is we see the same with domestic violence or physical abuse in general. Not everyone that is physically abused as children will become abusers, but everyone who is an abuser was usually abused in their childhood. That was something that I went to a conference that we had talked about. And although it's difficult to take a stance of empathy for an abuser, it's like hurt people. And I know for you, because you see some heinous abusers, it's probably difficult to be like, have some empathy for them.
I mean, you can still be empathetic, but it doesn't change how you perform your job. But at the same time, you hear about a lot of people's stories and stuff like that. And it's really true for the fact that, especially with violent crimes and especially with sexual crimes and especially with just, you see how people behaved and acted towards them. And then they reflect that on the basis of their life because that's what they were taught. Right. They were taught that if I act and my parents acted and behaved a certain way, and they rationalized that as okay. So then they do that to someone else, and then they're stopped, and then they get convicted of a crime based off that. Sometimes they have the rationalization that they know that what they were doing was not okay, but it's other aspects. There's some people that literally don't understand.
Because it's so ingrained.
It's so ingrained in their system. It's so ingrained in their mind that they're like, this wasn't okay. But like, they're obviously like armed robbery. Like, you automatically do that crime and that's not okay.
I see this sometimes with parents when people think that they can hit their kids as a form of punishment. And 30, 40, 50 years ago, this was the way. There was no research, but in 2022, there is plenty of research. And hitting children does have adverse outcomes. Hitting children is not really, if we look at it from a research standpoint, taking my opinion out of it, it is not an appropriate way to reprimand children. It's going to have negative effects. And when you scare and hit children, what they learn is that I have to internalize things. I can't do what I want, say what I want. They become kind of people pleasers in a sense because they become scared. They can't process emotions appropriately because when they do things that are negative, they get hit and they're supposed to deal with that. Also, to bring it back to the ACE study, all of the things that we've been talking about do relate. But just to give you some more fun facts, if a person has an ACE score greater than 4, they have a 250%, so that means 2.5 times greater risk of being obese. They also have a 3.5 higher rate of depression. If they have an ACE score of 5 or more, a 3-time increased risk of using antidepressant medications. An ACE score greater of 4, they have a 13.5 times more likely to commit suicide. That's crazy. ACE score greater of 6, they have a 30 to 50 times greater risk of suicide. So to put that into perspective, suicide is the 10th leading cause of death in adults, but unintentional deaths is number 3. So a lot of times people may commit suicide and it gets ruled as unintentional death because they don't know. And if they don't know, it gets put on the unintentional death list, not the suicide death list. So although suicide is the 10th leading cause of death, it's actually probably higher than that. And that's for adults. Now, here's the really crazy stuff is that between ages 10 and 24, suicide is the leading cause of death. So this is all important stuff. If you have an ACE score higher than 6, you're at a 30 to 50 times greater chance of committing suicide than somebody that has an ACE score of 0. So that's a lot. There's also some more crazy numbers. If your ACE score is greater than 5, you have 2 times the likelihood of being on anti-anxiety medications, 2 times risk of smoking. If it's 6 or more, then you have a 2.5 times risk of smoking. If it's greater than 4, you have a 6.5 times more likely to have alcoholism. If it's 4 or more, you are 30 times more likely to inject drugs. That's a lot. And if it is an ACE score of 6 or more, you are 46 times more likely to inject drugs. And it just goes on and on. There's tons of stats. This study is a huge study. I won't read them all, but in summary, if your ACE score is higher, your risk of perpetrating violence, having hallucinations, being prescribed an antipsychotic, impaired work performance, COPD, heart disease, liver disease, somatic disorders is all higher. And if your ACE score is greater than 6, you will most likely die 20 years early.
We could just look at it this way even with if you're going through an AA class or if you're going through anything in regards to that with like drug or alcohol addiction, they automatically tell you that if you have a parent or if you have someone in your someone that is in your family that had an alcohol addiction or drug addiction, they will tell you that's already ingrained in your genetics and stuff like that, that you have a higher risk of becoming an addict, of becoming an alcoholic and stuff like that. It doesn't just affect you, but that'll affect your children. It's building up the stresses that you've had. Not only that, but it's building up the stresses that your parents had and your grandparents had, and just anything that is considered a stressor. It's just continuously building up.
That's a big thing with the ACE study is it makes us question, like, is it genetics or is it like repeat trauma? Because it can cycle. If proper treatment and resources, if they're not available, trauma can repeat itself. Say you grow up in a household where your parents are substance abusers and your dad at night is an alcoholic, and so he drinks all day, then he hits you because he has impaired judgment, and then he passes out and falls asleep so you don't get dinner. Or maybe you're in a one-parent household. Like right there, you already have 4 or 5 ACEs just from that one experience. One-parent household, physical abuse, neglect, alcoholism. Right there, you got 4 ACEs. And you may grow up now a much higher rate of you then becoming an alcoholic or having these different health outcomes. And then it just cycles. And I think that's why it's really important that we prevent these adverse childhood events. And in doing that, we need to have, I have a list, we need to strengthen economic supports for families, helping families financially, having policies that support parents, promote social norms that protect against violence and adversity. So public education, like we talked about earlier, hitting kids is a form of discipline. A lot of people don't know that has adverse health outcomes, and that's why it's important we educate people on it. Legislature to reduce corporal punishment, bystander approaches, men and boys as allies in prevention. We want to ensure a strong start for children, so early childhood home visits, high quality childcare, preschool enrichment. We want to teach skills about social, emotional learning, safe dating, healthy relationships, parenting skills, connecting youth to caring adults and activities through mentoring programs and after-school programs, and intervening to lessen immediate and long-term harms. So this can happen through primary care, victim-centered services, treatments to prevent problems with behavior and future involvement in violence, and family-centered treatment. And we can raise awareness about adverse childhood experiences, so changing how people think about the causes of adverse childhood experiences and how we can help prevent them, shift the focus from the individual responsible to community solutions. That's important. You probably see this. I know you, not to give too many specifics, but I know that you did some probation and parole stuff in the community, and you have seen kind of troubled communities or lower income gangs, like things like that.
You don't need to be in law enforcement for that. You could step into a certain city or certain aspects and realize that you're in a rough place. And then there's some places that are highly successful, and then there's some places that you look at and you go, I kind of don't want to be walking around the streets here at night by myself. And
then you wonder, like, being a child there, you probably have to join a gang for your safety. And now you're in a gang. We were just watching 60 Days In last night. This guy was in, the Latin Kings, and then he wanted to leave. He decided he doesn't want to do this anymore, and they stabbed him 12 times. You make these decisions as children. From a developmental standpoint, children, their biggest developmental milestone when they're preteens to teens is peer acceptance. So when you're at that age and you're in a community that you feel unsafe and all your friends are joining gangs and that's the cool thing to do, you're going to do it. That is your developmental milestone.
Definition of gang, it's a group of people who are in a community that have a mutual interest about something and have the objective and goal that they're going to accomplish. Example, this gang is called Brothers of the White Warriors. It was actually established up in New Hampshire. They were getting pushed off by other gangs. It was a white supremacist group that was created to protect themselves from the other gangs that were in that area.
Oh.
Shortly after they were created, they were in the top 5 largest gangs in the United States.
That's so crazy. I guess it could be a situation like that where they're creating a gang to protect themselves from other gangs. I'm just thinking children grow up in a community that you step out on the street and you're scared, you're uncomfortable, there's gangs around, and all their friends are joining gangs, they're going to join gangs. And then when their frontal lobe fully forms when they're 24 and they're like, oh, I don't really want to do this anymore, I want to have children and have a family and get a legit job, then they stab them 12 times and they end up in the emergency room. Or dead. It's crazy to me. So I think that's why, going off this point, that shifting the focus from individual responsibility to community solutions. Yes, these people might be gang members, come into the prison, but it's not necessarily them. It's it stems all the way back to their community. And that's why it's so important to help these communities. A lot of it is these children, they might come from a single family household with just a mother, especially if they're boys. Then they look up to the older men in their community or in their 20s that usually are gang members. And that's their male person that they look up to. And they don't have a father, so that becomes their father figure. And they see these guys selling drugs, doing bad things, and making money. And they start to correlate, oh, if I'm going to be successful, those are the things I have to do. It's not go to school, get a good job, because no one is being a role model for that. And again, coming back to childhood development, it's peer acceptance and it's also role modeling. So they're looking for role models. And unfortunately, like, you grow up in these communities, it's very easy to fall into that cycle. So where is the responsibility from the rest of us to intervene?
Going back to my previous experience before I'm doing what I'm doing now, I did teaching and also worked with youth groups.
Oh, yeah, you did.
And one of the most heartbreaking things about that was, like, in the area that I was working, it was highly gang related.
Oh, yeah, it's a bad area. I know the area you worked in is a
rough
bad
area. And my first day on the job, like, I might as well have been in corrections. Like, in some aspects, I compared to what I learned as a youth counselor compared to what I do in corrections now. Because in my first day, there was a fist fight between two gang members, and it's heartbreaking because one gang member was 11 years old and another one was 13 years old. And then they were talking about how their dad was serving jail time for relation in being a gang. And then you'd step out of the youth group that you were working for the day. You look down, you see a cartridge, you see a bullet casing.
Oh my goodness, for a gun?
Yeah. You would just look down and you'd see, like, you knew that you were in a rough area. And
that's so crazy.
And you would have these kids that they would talk about gang related stuff all day. And the only way that you can really do anything about it is if, like, you encourage them to do other things. You break the system because their family is related to the gangs, their father's related to the gangs, their mother's related to the gangs. And if you can promote a different system and then change that mentality and behavior, which that's going to be a really long time before we could do anything, then maybe we can actually change things for the better, promote jobs in those low-paying areas. Because that's another thing, too. The reason why they want to make that money is because there's no other way to make that money in that area.
Exactly.
And the unfortunate thing about corrections is there's two different kinds of law enforcement. There's preventative and then there's reactive. And when you are in corrections, or if you're involving yourself in situations like this in high crime areas with gang-related stuff, you're trying to do the preventative, but it's more of you see something going on and then you react to that. Like, for example, prison, two people fighting. You're reacting to that and you're stopping the fight from happening. You are reacting to the situation in front of you. You don't have the full detail. You don't have the full picture. You don't have the full understanding of what's going on. But you two people fighting, so you have to stop it because you have to protect people's lives.
I think us as a society, we're very reactive. What we need is the proactive. Like, how do we stop it or intervene?
It just breaks your heart a little bit for the fact that you realize that these kids are involved. And then, like, when you hear, oh, my dad's in the slammer.
Yeah.
And then you see the mentality of that and rationalizing that's okay and that's cool.
Yeah.
And then you realize that, again, going to adverse childs, like, if he's rationalizing that that role model is doing something that's okay. Right. He's already part of the cycle.
And then another kind of issue too is, and I see this in child psychiatry, you hear these backstories and they're horrible. I was getting a lot of secondary trauma. Like, it's very difficult for me to see a child hear these horrific stories and then go home and live a normal life. It's just hard for me. With adults, I don't take on as much of that because I can rationalize that adults are independent and they can make their own decisions and they can most often get themselves out of bad situations. But you see these kids who go through these traumas or neglect. When I started working in psych, the way some people grow up, it's horrific. And a lot of us turn a blind eye to it because we don't want to face it. We don't want to hear about it. It's one of those things like, hush, we don't want to talk about it. But
yeah, some people just don't want to deal with it.
Yeah, but it's like our responsibility to help people. I know from a nursing standpoint, I think that's why I am very passionate about patients that have substance abuse, because these people that have substance abuse issues, it just controls their life. And if someone really wants help, wants to be detoxed, all this stuff, I want to be their partner in that. I want to help them, because it does then trickle down to their children, their families, like their life. And even if somebody has to come back 3, 4, 5, 6 times, I will always be there and be so supportive in their treatment, because it just takes that one time. Like, I have seen patients that have come in to be detoxed multiple times, and then it's just that one time.
It comes through rationalization and the realization that they want to do that.
Right.
And that's different for everyone too, because you could have, again, you'll see people re-institutionalized, and then you look at them going back into the prison and you go, what the heck, man? You're so used to living there because you've lived there on and off for the last 15, 20 years, nothing else.
I've definitely had patients that are like, I want to go back to prison. That's my safe space. I've actually had people say that to me.
Or even people that go, if I go out on the streets, I'm going to reoffend.
Right. To go back.
Don't let me on the streets. I will do the exact same thing that I did previously, and I will be back here. But they're so ingrained in living a prison life that they know nothing else, and they don't feel comfortable with anything else. For example, like someone that's been in prison for 15 years and they had a substance abuse issue, but they had some other issue that caused them to have 15 years. When then they go out and then they had the same stresses that caused them to offend in the first place, and now that they're going back into substance abuse. They may have been clean for 10 years, but because they are now exposed to the drugs, they could not break that addiction.
I would imagine, too, getting discharged from prison is very stressful. Patients that I've talked to, they say the structure of prison, they like it. Like, they know the time they're going to get up. They know when they have their breakfast. They know when it's
and some people need that structure.
Exactly. Yeah.
But just correcting behavior and changing the mentality for the next day.
Yeah. So just to bring it back to the ACE study. So last kind of fun facts that I have. So we went over how do we prevent adverse childhood experience. And part of that, I think we talked about raising awareness. Yeah, we were on shifting the focus from the individual responsible to community solutions. We also want to reduce the stigma around seeking help with parenting challenges or substance misuse, depression, or suicidal thoughts, promote safe, stable, nurturing relationships and environments where children can learn and play to help them reach their full potential, and create neighborhoods, communities, and a world where every child thrives. So the other part of this is, what if you're somebody listening to this podcast who has had adverse childhood experiences, and you know that, and you want to help work through those things? Because that's another part, right? We can work to prevent, but what do we do when they've already happened? A lot of probably 6-year-olds who are going through traumatic events aren't listening to this podcast. So if you're someone who has been through adverse childhood events and you want to know what is the treatment, this is not going to be fully in depth, but this is going to be a summary of different avenues that you could possibly look into after this podcast. Different mind-body work like mindfulness and yoga, these things will help to bring down your sympathetic nervous system. Like we talked about earlier, that hypervigilance, always being on edge, always looking over your shoulder, because as a child, you never knew what was going to happen to you. You can activate your parasympathetic nervous system. So that is the part of our body that helps relax us, bring down our blood pressure by doing things like yoga, mindfulness, meditation, deep breathing through deep belly breathing. Another thing you can look into is something called inner child work, which is really great. You pretty much go back and reparent yourself. You look at different situations that you went through as a child, and you take the stance as being the adult in the room, what you would say, how things could have went different, how things should have went. A lot of times when traumatic things happen to us as children, our minds cannot process them correctly. So we look at it like, I am bad. I made mommy or daddy upset. This is my problem, my lack, my negative characteristics that I possess. But if you actually go back and put yourself in the room during that experience of watching yourself as a child, you'll find that your thought process will change. You'll actually see it as, wow, this is my mom or dad's issue. This is not a reflection of me. I was a good kid. I was just trying my best. I was acting like a 6-year-old. I didn't deserve to be slapped across the face. All of these types of things. Inner child work is really amazing. So that's something you can look into. Also trauma therapy, there's CBT, there is prolonged exposure therapy. There's all different types of trauma therapy. Another great thing is something called EMDR. And if you look it up online, it looks a little funny. I'm not going to lie to you. They pretty much have this little stick and they like wave it in front of your eyes. And it's different than any talk therapy because it doesn't require you to explain trauma in detail. It uses something called eye movements, or you can also do tapping while focusing on an image related to the trauma, and it helps you become unstuck so that your brain can go through its natural healing process. They find that this has worked really well for veterans with PTSD and things like that. So that's just another kind of thing that you can look into. I have a bunch of different therapies listed here, so I'm not going to read them all. And there's also medication. I know a lot of people don't like medication, but medication is a tool that we can use to help us in life. So maybe you do therapy, but maybe you do need a medication to help you relax in certain situations. It doesn't always have to be something like a benzodiazepine, which there is an addictive component to, so you have to be very careful. Sometimes prescribers will give blood pressure medication to help bring your blood pressure down in those moments where you're getting like very amped up, which can be helpful if you have a panic disorder or something related to your childhood trauma. So again, finding a good psychiatrist or psychiatric nurse practitioner. I personally would recommend that you get a psychiatrist or a psychiatric nurse practitioner. Primary care doctors or nurse practitioners, family nurse practitioners, they are great for medical things, but they do not get the advanced training in psychiatry specifically. And if you're dealing with very traumatic childhoods, I would recommend you see someone who specializes in psychiatry. I think that is mostly what I have on here. My other last note, sorry, I'm rambling, James, you're just listening to me, but my other last thing to note is if you are a nurse practitioner or a therapist or somebody listening to this podcast for an educational purpose, my last little food for thought in researching is the power of 2 minutes, asking, listening, and accepting. So asking patients, do you have a history of trauma? A lot of people don't ask this. And I think I talked about at the beginning, it might be on a different podcast, but they found that like primary care doctors, I believe it was only 19% were asking about histories of trauma. So these are things that are really important that we know, and people aren't going to just tell us this stuff. And a lot of times you'll find in your patients that at first they're like, nope, no history. And then as you build that therapeutic alliance, they do tell you there was this one thing when I was a child, this happened. Just trying to ask and then listen to what they're saying and show acceptance. A lot of people, especially men, there's a lot of shame around these situations, and showing acceptance, and you can really build that therapeutic alliance. And I'll put on the show notes a lot of different ways that you can ask these types of questions to your patients as well, along with all of the references. All right, that is my ramble. Do you have anything to add, James?
I'm just saying, even for that last aspect, even when people go through therapy, they're not going to open up about that, but then eventually they'll finally open up to it. And then you'll have the realization of, oh, maybe I should have done this in the first place, of the stress and the stress therapy and stuff like that, and the trauma therapy.
Yeah. Because you hold it in for so long, you hide it from the world. You're not going to meet one random person and be like, actually, I'm going to spill everything out to you. We have to create that therapeutic alliance.
Well, a law enforcement officer isn't going to be like, oh, I have PTSD or I have stress from my situations. I am going to bed at night and reliving this situation every single time I shut my eyes. They're not going to open up about that. They're not going to tell you about that. One person told me about one of their counseling sessions, and their counselor said after 4 months or 5 months of them going through the counseling that they're like, I never saw you smile, or I never heard you laugh until 4 months deep into the counseling. Or even opening up and talking about like trauma from the job or trauma from the childhood. Because that's something that you need to build rapport, and especially in law enforcement, or someone who's been through trauma, or someone that just has difficulty opening up. They're not going to open up until they feel comfortable. And even if they build a rapport, they may not necessarily tell you about it. You might have to rationalize and realize that something else is going on, and then poke and prod on those questions to be able to ask about it. Because like someone may have repressed memories. Law enforcement usually is really good at keeping things in.
Yeah. And like you said, sometimes I think we have to poke and prod. Somebody might not openly be like, oh, my parents were physically abusive or something like that, you might have to ask questions. So what was your childhood like? Tell me about your mom or your dad, and let them start going to then get them to open up about those types of things.
A lot of officers and a lot of people take their stressors home.
Yeah.
And they don't have proper coping mechanisms to be able to shut that off.
Right.
If you have family members that take out stressors in not the healthiest way to handle it. For example, law enforcement officers do it. They go home and then they have a few drinks. They have a nightcap, and that one drink turns into two, and that other drink turns into three.
A lot of people don't seek help until they reach a point where it's like they have to.
Or they hit rock bottom, or something that they developed. That could have been something that their mom and dad did. Way of handling stress may not have necessarily been learned behavior, which brings it back to this main topic.
The adverse childhood experiences, because it is a cycle if we don't.
It goes full circle, yeah.
Intervene. I think this is a good discussion.